So, Terry, clearly this isn't the case, but let's assume that you're at the far end of the scale in efficiency, at the wrong end of the scale in your LHD, and I hasten to add you're not. But if you were, what's the approach that you, within your LHD, are going to take to actually bringing your services back towards the state efficient price?
There, but for the grace of God, go we, is the first position to start with. I think the first is to make sure that you've got robust discussion, accept the fact that it's not going to happen today, but you have to have a time frame within which it's going to happen, and then get the data out there. Now, if I just talk about, make a comment about one of the previous questions about what's important with getting clinical engagement, I think there are a couple of other things as well that weren't mentioned. One is consistency over time. The second is doing what you say you're going to do and not saying one thing and doing another. And the third is only changing the information if it's very clear that you got it wrong, and then you fess up and you go and you have the discussion with mature adults in the room, which means everyone, and say, we didn't get that right, we need to change that. But only doing that if it's absolutely necessary. So consistency over time. So in the first year that you have a plan and you've had that discussion, everyone's going to be sceptical, and the normal things are going to come out. The data's wrong. The information's correct. John Roger's got it wrong again. All right? The finance people have got it wrong. It's just management saying that because they want us to do it at less price. So you then got to have the discussion. The best place to have this is at your district, first of all. Intuitively you might say at your board. I think the first place you've got to have that is at your clinical and quality council at a district level first. That's where the discussion's got to be. That's where all the data and information's got to be. We've got highly intelligent, educated people sitting around the room, and they've got to have the discussion, and you've got to have all of the scepticism out on the table and deal with it. Then it's got to go back to facility and service clinical councils, and they've got to have that discussion there. And management and board have got to be prepared to go out and have those discussions and take the brickbats, go through it. If people are concerned about the data, go through and troll through it. Nothing focuses a person like having a sick or crook patient in front of you that needs help. Likewise, nothing focuses you more than knowing that that's what you've got to do, and that you've got a limited budget and more activity than you can possibly afford to do, and you've got to make those decisions. So I think if you're at the far end, you've got to have all those discussions, get the data on the table, go through it all, even if you've got to do it half a dozen times, have the discussion, get a plan. That plan's then got to be going forward from your clinical and quality council to your board, and your board has to understand it. The board has to be engaged with it. It has to ask every and all questions it needs to be comfortable that what needs to be done can be done. And then it needs to take that forward to a discussion with the ministry, and there needs to be a plan put in place over a period of time that recognises that there will be a transitional grant, but it's got to be limited, it's got to come down each year. Realistically, if you're at the far end, it's going to take you 3 years. I think there's got to be an acceptance by the ministry of that, but there's got to be a resolve on behalf of the clinicians and the management and the board to make sure it does. And then you've just got to execute it, be consistent over time, have all the feedback that you need to have, keep working on it, make sure the data is there for anyone and everyone who wants to see it, and keep having the discussions. There will be hard decisions to be had. They'll have to be made. They'll have to be confronted. But it's doable. It actually is doable. There has to be some reward, I think, from the ministry and from the minister in relation to, well, if you said you were going to do this and you actually did bring it down, okay, well, we need to acknowledge and recognise that. Acknowledgement with the community is really important. I don't have enough wisdom to know how to do that well, and that's something we in our district are still struggling with, how you have that debate and that discussion with the community. But you have to start it, even if you're not exactly sure whether or not it's going to work or whether it's going to be effective. That would be my plan. Oh, sorry, and one last thing, and keep having a monthly meeting with John Roach.